client that you're just on Suboxone and that there's not any other mood-altering drugs in your system. If you relapse and we detect other mood-altering drugs, it'll be up to the discretion of the treating physician on whether we would discharge you from the program or not. If an individual learns by their relapse and can show us how they would prevent it from happening again, then it might not be a total waste. It might be a learning experience. And if they show willingness to learn by it, then we may not, or probably won't discharge them. It's important to keep Suboxone out of reach of children. The film comes in a child protective package, which is hard for adults to open. But you still should not use it in their presence because it's orange flavored, kind of looks like candy, and if they can get into it, children will find a way. Or pets. We have had some pets get into Suboxone and have some issues. A lethal dose for like a 15-20 kilogram child, which is around 30-40 pounds, would be around 32 milligrams or 4 strips. So it doesn't take much, so it's extremely important to keep it out of reach of children. The diversion problem with Suboxone is becoming a big deal, and it makes me very angry. Every time there's a drug bust or of a heroin dealer, they always find Suboxone. In fact, Suboxone has exceeded methadone now in the amount of drugs being seized in drug raids. And if this isn't brought under better control, we could lose the privilege of being able to treat patients in an outpatient setting. It may go back to the way it was a decade or two ago. So if we suspect patients are selling their medication or diverting it, then we'll call them in for a pill count, and that's our way of determining if they're selling. If they don't have the amount of medication remaining based on when it was filled, then we'll assume that they're up to no good and they'll be discharged. I hope this isn't an issue for any of our patients, but we take it that seriously. The government wants us to lay eyes on patients, and particularly within the first year, it's extremely important to see you every month, so we will require you to come in every month. We do not accept insurance for the office visit. I usually tell patients that when they first call and inquire about Suboxone. The reason for that is because insurers only pay a fraction of the office visit, and since providers are restricted to either 30 or 100 patients, almost all doctors don't accept insurance. There are a few who do, but they have a very long waiting list. So we don't accept insurance for the office visit, although most of the insurers do pay for the medication. And if they require us to do some sort of paperwork or forms to be filled out or phone calls to be made, we do all that for you as a courtesy to get your medicine obtained. It's extremely important to understand, though, that if the insurance company denies your request for medication, perhaps because you used some benzodiazepines or went to the dentist and got a prescription for Vicodin while you were under our treatment, or for a variety of reasons, and they deny that, that's outside our control. And I won't get involved in appeals with your insurance company because it's a lengthy, time-consuming, usually unsuccessful process. So the best advice I can give you is just adhere to the program. Don't take any narcotics from the ER or the dentist. And things should be fine. But you have to understand that the insurers are so tight-fisted, essentially, they look for any reason to deny you payment for your medications. So you have to toe the line and adhere to everything. Have all your I's dotted and T's crossed. In my opinion, AA and NA are the best ways of recovering, developing life skills to be off drugs down the line. If you have a good support group and a home group and a sponsor and you've worked steps, then when you get off the Suboxone, you have skills to deal with life when it comes at you on life's terms. If you haven't done that, then the first time adversity comes your way, you're going to go back to what you know, which is using drugs. Using drugs is our coping skill, it's our crutch, and we need to change that. We have a firm policy on prescribing no more than 60 tablets a month or 2 pills a day. Please don't ask the doctor to deviate from that. If you do, it would be cause for discharge. We do reserve the right to discuss your medicine with the pharmacist if he calls and wants to clarify something. Other than that, your privacy is guaranteed by the HIPAA laws, and no employer or family member can obtain information about your care without your signing a form which authorizes us to do so. So you can be assured that everything is entirely confidential. It's very important that you notify us, female patients, if you become pregnant. We do not treat pregnant women. We refer them to high-risk obstetricians who will continue your treatment, usually with Subutex, which is just plain buprenorphine, although increasingly they are starting to adopt Suboxone and OB programs. It's important that we have a good address and phone number so that we can contact you for a variety of situations or concerns, but most importantly, if we call you in for a pill count, we need to be able to get a hold of you. You have 48 hours to respond to a pill count. If you don't respond, then we'll assume that that's because you've been diverting your medications and you don't have the medicine to show up and have us count it. In patients who live far away, we don't necessarily require you to come to the office for a pill count. If your pharmacy is willing to do the pill count for you and fax us the results, that's completely acceptable. Just a little update on, I'm developing a program called Recovery University, and it's going to consist of at least 12 modules for the first year. And each month will be a module on recovery or the disease model of addiction or a variety of topics. I'll be doing some of this speaking. There may be other physicians in recovery who might take a topic and develop it for the month. But the point of this is to have some formal good counseling in place and education. It'll be followed up with a small self-test that you need to complete, and this will be placed on your medical record to prove to insurers and any other entities that we are serious about recovery and documenting that you're working a program of recovery. There'll be more on that coming down the line, but hopefully we'll be able to have you watch these videos online and do the self-test online. If you don't have computer access, we have a nice, this is the conference room that I'm speaking in, and we have a 84-inch screen and a projector that you could watch any of these videos on and do your self-test in the conference room. In fact, I may, in busy situations, have patients watch these modules while they're waiting to be seen. In conclusion, I'd like to welcome you to getting back your life. You should be excited and sick and tired of being sick and tired and ready for a new way to live, as they say in NA. Our motto is Parata ad vitam in life's terminum, which means ready for life on life's terms. And that's where I hope you'll be when you finish your program here. Again, on behalf of all the physicians and myself and our staff, I'd like to welcome you and look forward to working with you down the line. Thank you.